Hello everybody, I am Dr. Robin Clark, Medical Director of Bupa Global and UK Insurance, and it's my pleasure to give you an update with regard to the current situation around COVID-19. First of all, let's talk about variants. Now, many of you will have heard a lot of discussion around the different types of variants, and the World Health Organization keep a close eye on both the variants of interest and the variants of concern. Now, the difference between those two is the variants of interest are the variants of COVID-19 that have the potential to cause a public health problem, as opposed to the variants of concern, where those variants are actually demonstrating a definite public health problem. Now, over time, what's happened is the World Health Organization had an increasing list of variants that they were monitoring. But actually that list now is being shrunk down. The World Health Organization are removing variants off of that list. The reason for that is that the Delta variant has surpassed all of the others to the point where, in fact, some variants are now being declared provisionally extinct. So in other words, the Delta variant has outcompeted some of the other variants. So what we're seeing now in the UK is that over 99% of all the new infections are the Delta variant. And that's also a trend that we're seeing across the world. I'd just like to take a moment now to talk a little bit about vaccination. And there's been some really interesting research that's come out recently that really just demonstrates how good vaccine and vaccination is with regard to reducing severe disease and reducing the rates of hospitalization. So there's one particular study done by Kaiser Permanente in California, and they studied 3.4 million people who had been fully vaccinated with the Pfizer vaccine. And they followed their care and their levels of illness over a period of 6 months so that they could see who caught COVID and at what point after the vaccination they caught COVID. Now, the results of this were really quite encouraging. So the overall effectiveness of the vaccine was 73%. So 73% likelihood of the vaccine preventing you from catching coronavirus. But perhaps more importantly, there was a 90% protection rate against severe disease and against hospitalization. In terms of the timing, what they also discovered is that after about 5 months, so 5 months after your vaccine, about half of your resistance to coronavirus had dropped off. Having said that, they did still prove that the level of protection against hospitalization remained stable over that period of time. So even though your resistance to coronavirus was beginning to drop, actually you were still far less likely to end up in hospital. And those figures were also the same when they considered the Delta variant in the data. So overall, really what it was showing is that vaccination really is very effective, particularly against hospitalization. But it also gives that insight into the fact that a booster dose may be needed. I'd just like to take a few moments now just to talk about testing. Now, UCL, so University College London, have done some remodeling of the data behind the different types of testing that we have available. And what they actually discovered is that the lateral flow tests are actually more accurate than we first thought. So some of you may have heard stories that someone had had a PCR test, which was positive, and then they'd gone on to have a lateral flow test, which was negative. And actually, as a result of some of this work, we can now understand why that is. And it's simply because the tests are for different purposes and they're measuring different things. So the lateral flow test, what that is doing is detecting the protein surface of the virus. So it's detecting that viral material in your nose and in your throat when you're actively infected. And actually what the data showed is that the lateral flow test was more than 80% effective at detecting any level of infection. But when you were the most infected and had the highest level of viral material in the nose and throat, the lateral flow tests are actually more than 90% effective. Now, if for a moment we just compare that to the PCR test and what the PCR test is measuring, that's actually detecting the virus's genetic material. And what can happen is once your body has fought off the virus, you can still have viral material in your nose and your throat, but the virus is dead. But the test doesn't know that. So the test can still come back as being positive, even though you are no longer infectious. So really what the PCR test is measuring is, have you been infected at some point in recent history? whereas the lateral flow test rather is measuring, are you likely to be infected now? So that's the difference between the two, and why sometimes you can get different results from effectively what is meant to be a similar test. Finally, I'd like to just talk about immunity and what does the future hold? So, as we've said, it looks like immunity as a result of the coronavirus vaccination, or perhaps even the coronavirus infection itself, wanes after approximately 6 months. So this is some of the basis for the 6-month booster vaccination program, which is now being rolled out to people that have either a weakened immune system or that are at particularly high risk. The other thing that's been going on is quite a lot of modelling around what's likely to happen with future infections and future bouts of coronavirus. So it seems likely at the moment that what we're going to see is a seasonality around coronavirus, particularly around winter. So the expectation is that we'll have a winter peak similar that we do with flu at the moment. And it's likely that that happens on an annual, perhaps a biannual basis, again, as suggested by the modelling. What we do know from research so far is that actually, if you are co-infected, so in other words, if you have the infection of both coronavirus and flu at the same time, then that is doubly risky for you. It does actually double the risk of death. So I think a strong message there for those who are invited, both for their coronavirus vaccination and their flu vaccination. Do go and get those, because as the data has shown, it is very good at protecting you from severe disease and hospitalization. And then the final interesting thing is around the behavior change. So, many of us worldwide have heeded the message of wearing masks and hand washing. And when countries have eased restrictions, there was the expectation that actually levels of coronavirus were going to bounce back up. Sometimes the expectation was that was going to happen quite quickly. But actually the reality was, when those restrictions were lifted, the level of coronavirus didn't bounce back as quickly as expected. And that's thought to be because the levels of mask wearing and hand washing have persisted within the population, and that has helped to keep those coronavirus levels low. So a good news story there as well. So overall, I think what we can say is vaccination and the public health measures that have been put in place for coronavirus have certainly had many benefits. We know that the vaccination is very effective, particularly against severe disease and hospitalization. And if you are eligible for your vaccine, or if you haven't had it yet, then please do go and protect yourselves. Thank you very much.